A new normal in San Antonio starts Monday. You will be officially required to wear a mask when you're in public places where it's difficult to socially distance. The city and Bexar County announced this rule tonight as they try to stop the coronavirus spread. The city clarified just minutes ago they're giving the public until Monday to get their masks. Eyewitness News reporter Holly Stouffer joins us live. And Holly, this is because people who don't even know they have the virus could be spreading it.
Exactly, Deborah. These masks stop people from coughing and spreading germs to the people around them. Right now, I'm not wearing mine because it's just myself and my photographer out here, and we're able to keep the distance between us. But city officials say if you're in a place that has a lot of people, you need to have something covering your nose and mouth.
This is the next step.
Everyone 10 years and older needs to have some type of cloth face covering when they go outside. Mayor Ron Nirenberg shows off his Texas theme mask during the announcement. Judge Nelson Wolf wears a bandana to show there are multiple options to choose from.
And I think we've seen some success in Hong Kong and Taiwan, where early on they got masks up and going.
However, you don't need to have your face covered when you're exercising, driving alone, or pumping gas. Metro Health Medical Director Dr. Junda Wu says this will help slow the spread, since some people carrying the virus may not show any symptoms.
When most people think about masks, they think that they're protecting themselves from other people, but there's more science to show that it protects other people from you.
While the mask is an added precaution, Dr. Wu says social distancing is still the best way to protect ourselves.
That's a lot more powerful than wearing the mask, is keeping that 6-foot distance. So the mask is for when you can't really keep that 6-foot distance.
Business owners have 3 days to get masks for their employees. For now, the city is relying on the honor code.
We think they're going to do it because they want to stay alive and stay healthy.
But under the order, you could be fined $1,000 if they catch you not wearing one. And Mayor Nirenberg made it a point to say cloth face coverings because he doesn't want people taking surgical masks away from doctors, nurses, and first responders who really need them. And if you can't find yourself a cloth mask, you've got other alternatives. You could use a scarf and wrap this around your face. You could also use a t-shirt, because when you wrap this up pretty tightly and use 2 rubber bands, it'll also get the job done. We've got more ways you could make yourself a do-it-yourself mask posted on our website. We're live on the northwest side tonight. Holly Stouffer, KENS 5 Eyewitness News.
Holly, thank you. New at 10, we are learning about the youngest victim in San Antonio to die from the coronavirus. Only Eyewitness News reporter Henry Ramos shares his story in hopes to save others.
Juan Hernandez was the type of man.
He had a big heart. He was giving.
Who would give the shirt off his back.
It's just unbelievable that we would lose somebody so young.
The 38-year-old died Monday at Northeast Baptist Hospital from the coronavirus.
High fever. His, lungs were not properly working right, and they had him on a ventilator.
He was in the hospital for 3 weeks.
Because of the virus, nobody could be by his side.
Robert Salcido knew Juan for 19 years. The two were close friends.
I didn't know the last time I saw you was going to be the last time that I saw you, or the last time I could say that I love you, or the last time I could give you a hug.
Salcido says Juan got sick just after St. Patrick's Day and went to the doctor. He took meds for a cold, but he still wasn't feeling better. He was admitted here at the hospital in late March. He lost his fight weeks later.
The fact that this is happening to so many families, it's not a dream. It's reality.
Juan's loved ones want to warn others, especially those who are young.
Take this seriously. Stay home. Protect yourself. If you have to go out, wear your mask, wear your gloves, whatever it takes to protect you. We can't take each other for granted.
So tragic. Henry joins us live from Northeast Baptist. Henry, how many young people are infected here in San Antonio with the virus?
Deborah, according to the latest numbers from the city, listen to this, more than half of the coronavirus cases in Bexar County are people 50 and under. I asked the mayor about this tonight, and listen to what he had to say about those even younger. The numbers aren't getting better.
Unfortunately, Henry, no, it's holding just as it was, which is that almost 40% of the people who turn up positive in our community are under 40 years old. So, it bears repeating, like you said, that nobody is invincible from this.
Nobody is invincible, an important message from this family and the mayor. By the way, Metro Health says the only person to die under 40 years old did have underlying health conditions. We're live outside Northeast Baptist. Henry Ramos, KENS 5 Eyewitness News.
Henry, thank you. The number of coronavirus cases in Bexar County tops 900 tonight. Metro Health now reports 918 cases. No new coronavirus deaths are reported. The total stands at 37. 176 people have recovered. An update on the Floresville Veterans Home that's dealing with coronavirus infections. 8 cases of the disease are now confirmed at the Frank M. Tejeda State Veterans Home. 1 resident has died. Some staff members have been tested, and the rest will be soon. Tonight, a San Antonio coronavirus patient is making history from his hospital bed. Jimmy Hayden is the first person in the city to be treated with plasma from a coronavirus survivor.
It's a very emotional journey that nobody wants to have to go on, especially when they can't be with their loved ones.
Tonight, we're hearing from his wife, who's grateful for this treatment. Let's bring in my co-anchor, Aaron Wright. And Aaron, this plasma therapy is bringing a lot of hope.
Deb, this plasma therapy could be a breakthrough, but right now doctors don't know for sure. Jimmy Hayden is improving, but until more testing is done, they aren't sure if this cure is going to be right for everyone.
Excruciating just to watch him walk in there, and it was hard to leave. Then to get the call a couple hours later, several hours later, that they were going to put him on a ventilator was very scary.
That's how Ashley Hayden recalls having to leave her husband when coronavirus symptoms made breathing difficult. That was back on April 2nd. Now she says he's doing much better.
He's able to talk. He's actually, today he was able to eat solid foods. So these are all great things, and he's taking great strides, and I can tell each time that I talk to him, he's getting stronger.
Jimmy Hayden is under the care of Methodist Stone Oak pulmonologist Dr. Pedro Lucero.
After we gave the plasma, we did see a dramatic improvement in some of the markers for him that show inflammation. But it's difficult to discern whether or not it was a plasma or was he actually getting better.
Coronavirus currently has no treatment, but blood plasma with antibodies from recovered patients could provide passive immunity to certain patients fighting the disease. Hayden received plasma from a San Antonio man who had recovered. Dr. Lucero is optimistic, but says more testing is needed before this type of treatment can be approved for every coronavirus patient.
I do hope it becomes an option because we have a donor pool of patients out there who potentially could donate.
This is a pretty good indicator that it's going to work for many people now.
The South Texas Blood and Tissue Center is calling for more donations from people who have survived COVID-19 and are in recovery from the coronavirus, fully recovered that is. So far, Metro Health says 176 people in our community have recovered. Deb, back to you.
That's really exciting news. Aaron, thank you. Tonight, President Trump is pushing forward with his plan to reopen the country. He released new guidelines this evening intended to ease states into reopening.
America wants to be open, and Americans want to be open. A national shutdown is not a sustainable long-term solution.
The president says governors of each state will be empowered to decide when it's time for them to reopen. Before a state opens up, the president says they should be on the downslope of new cases, be able to test their healthcare workers, and have hospitals that are not in crisis mode. Governor Greg Abbott is expected to announce a plan tomorrow to reopen Texas businesses. Today, protesters rallied at the Texas state capitol and the governor's mansion. They're asking the governor to put Texas back to work. Abbott says more than 1 million people have filed for unemployment in Texas since this crisis began. NFL star and Texas native Von Miller has the coronavirus. That's according to a report by the NFL Network. The Broncos pass rusher is reportedly in good spirits and is isolating at home. The former Texas A&M star is the second known NFL player to become infected.